Okay, now we're going to start getting into some of the really important stuff. We're going to talk about anatomical position, regions of the body, anatomical planes, sections, and directional terminology. You'll be using these throughout the semester in Bio 201 as well as in 202, as well as any allied health field that you may go into. So an anatomical position, basically the picture you're seeing in front of you is proper anatomical position. So take a look at how the hands are positioned. They are at the individual sides, palms facing forward. The head is also level, facing forward, so the person's not looking up or looking down or sideways. The head is not tilted. Their legs are basically shoulder width apart, straight underneath them. The knees are not bent. Toes are not turned out. And again, the person is standing up. This is anatomical position. So when we say that something is their left, we are talking about the individual's left. When we're talking about right, we're talking about the individual's right, not yours, always the individual's. We'll always be using terms referring to anatomical position. Sometimes you'll find an individual laying face down or face up. If they are, we consider that the prone. If they're laying face down, that is the prone position. If they're laying face up, that is the supine position. However, we still would refer to all those structures as if they were standing up, facing us, with their hands at their sides and feet shoulder width apart. So no matter how the person is situated, we always refer to everything in anatomical position. All right, we're going to go over a number of different regional names. Yes, you have to learn all of them. It'll seem like a lot right now, but these terms will keep coming up over and over and over again in 201 as well as in 202. So you might as well just learn them now. So here's just a summary of all those anatomical terms. Again, I know they seem like there's a lot, but we'll break that down. All right, so let's just take a look at the head. So whenever we're talking about the head as a region, we call that the cephalic area or the cephalic region. The skull is considered the cranial region. The face is the facial region. So some of these aren't that difficult, right? The forehead is the frontal region. You also have a frontal bone that is in the frontal region. Your temple, basically sort of at the side where your glasses, your sunglasses sort of stem would be. That's your temporal region. You also have a temporal bone there. The eye is called the orbital or ocular region. Otic is ear. Your cheek is buccal. Your nose is nasal. That should be pretty obvious. Mouth is oral. Chin is mental. You'll see later on you have mental foramen. You have mental nerves as well. And then the occipital area is the base of the skull. So that'd be the back of your head. Okay. Basically where you'd have like a ponytail would be the occipital area. The neck region is considered the cervical area. You have cervical vertebrae located there. If we take a look at the trunk, the anterior portion of the trunk, the thoracic region is the chest. The area where you have your breastbone is simply the sternal region. The breast area is the mammary region. Where you have your stomach is simply the abdominal region. Your umbilical region is simply where your navel is, your belly button. Coxal is simply the hip region. Okay, and honestly, we don't really use the term coxal too much. We'll be using probably the term hip more often. In the pelvic region, you'll see that in this image here. You have the groin, which is also known as the inguinal region. There's an inguinal canal there in males that allows the cords to descend to and from testes. And then simply the pubic region is where the pubis is. If we take a look at the posterior part of the trunk, where your shoulder blade is, that is your scapular region. The vertebral region is simply where the spinal column is, where your vertebrae are. Sacral region is sort of this very lower part of the back. Lumbar is really your lower back. Your coccygeal is further down. somewhere like right there where your butt crack is. That's where your tailbone is. And then the perineal region is between the anus and the external genitalia, not visible in this image. That's something that you'll be focusing more on in Bio 202 anyway. The upper limb, the acromial area is considered the shoulder. You'll see that when we get into bones, there's an acromial process in the shoulder area. Axillary is armpit, brachial is arm, antecubital is the front of the elbow, whereas antebrachial is forearm. Really, we're not going to use that term antebrachial too much. We'll probably refer to it more of as brachial arm. That we used quite a bit. And then we'll probably refer to this lower part of your limb as the forearm. Please keep this in mind. Make a note of it now. Write it down. Star it. Do something with it. Again, I cannot stress this highly enough. This upper part of the arm, or this upper part of the limb, is the arm. This lower part is the forearm. We're going to make this, I want to make this distinction clear because later on in the semester, when we refer to these are going to be very different regions, very different actions that occur there. The carpal is the wrist, manual is hand, palmar is palm, dorsum is the back of the hand, digits or phalanges are fingers, pollex is thumb. The olecranon or cubital is the area behind the elbow. We're going to see there's an olecranon process that makes up the elbow as well. So these terms again will come up over and over again. Taking a look at the lower limb, the gluteal area is what we refer to the buttocks as. Femoral area is the thigh. Patellar area is the kneecap. Popliteal is behind the knee. Crural is leg. And again, we don't really use that term crural very much in A&P. However, similar to the upper limb, the lower limb, I want to draw your attention to this top portion being the thigh and this lower portion being the leg. Again, as we'll talk about it later on the semester, movements at these two areas are going to be very different. It's very important that you understand the thigh is different than the leg. I understand that in everyday, normal speak, we refer to the whole limb as the leg. However, in anatomy and physiology, we make a distinction. Okay. Sural is the calf area. Again, we won't really use that term very much. We'll probably just refer to it as the calf. Pedal is foot. Tarsal is the ankle. We had carpal in the wrist. We now have tarsal in the ankle. Think T for toes. Calcaneal is where your heel is. You have a calcaneus bone there. Digits, phalanges, toes are named similar to fingers. Dorsum is simply the top of the foot. Plantar is the bottom or sole of the foot. Think of like plantar fasciitis. And hallux is your big toe.